In the USA, it's estimated that fatty liver disease affects 20 to 40% of the population. The scary and surprising fact is that this type of liver disease often doesn't cause any obvious fatty liver disease symptoms. Many people don't even realize their livers are fatty until they have testing, such as a CT scan or ultrasound, for another health concern, or they experience an obvious alert such as pain in the abdomen. Is having a fatty liver life-threatening? If left untreated and it progresses, a fatty liver can definitely be life-threatening. What is fatty liver disease? Fatty liver disease is a condition in which fat builds up in your liver. It happens when fat builds up in the liver. Fatty liver disease can occur when there is more than 5% fat in the liver. Having small amounts of fat in your liver is normal, but too much can become a health problem. The severity of a fatty liver, also called steatosis, can be a grade 1, grade 2 or grade 3 fatty liver. A fatty liver grade 2 is more serious and more likely to cause symptoms as compared to fatty liver grade 1. The more fat in the liver, the higher the grade and the more likely for the fatty liver to cause problems. There are also different kinds of fatty liver disease. Types of fatty liver disease. There are two main types. 1. What is nonalcoholic fatty liver disease, NAFLD? NAFLD is a type of fatty liver disease that is not related to heavy alcohol use. There are two kinds. Simple fatty liver, in which you have fat in your liver but little or no inflammation or liver cell damage. Simple fatty liver typically does not get bad enough to cause liver damage or complications. Non-alcoholic steatohepatitis, NASH, in which you have inflammation and liver cell damage, as well as fat in your liver. Inflammation and liver cell damage can cause fibrosis, or scarring, of the liver. NASH may lead to cirrhosis or liver cancer. 2. What is alcoholic fatty liver disease? Alcoholic fatty liver disease is due to heavy alcohol use. Your liver breaks down most of the alcohol you drink, so it can be removed from your body. But the process of breaking it down can generate harmful substances. These substances can damage liver cells, promote inflammation, and weaken your body's natural defenses. The more alcohol that you drink, the more you damage your liver. Alcoholic fatty liver disease is the earliest stage of alcohol-related liver disease. The next stages are alcoholic hepatitis and cirrhosis. Fatty liver disease symptoms. Doctors sometimes call fatty liver disease a silent disease. This is because a person might not experience any symptoms, even as the disease progresses. However, fatty liver disease can enlarge the liver. When this occurs, may cause pain or discomfort in the upper right side of the abdomen, which is the area between the hips and chest. Signs of a fatty liver, due to alcohol or other causes, can include fatigue, weakness, loss of appetite, nausea, abdominal pain especially in the upper right abdomen, swelling in the upper abdomen, spider-like blood vessels, itching, jaundice, yellowing of the skin and eyes, mental confusion, a buildup of fluid and swelling of the legs, edema, and abdomen, ascites. Causes of fatty liver. Fatty liver develops when your body produces too much fat or doesn't metabolize fat efficiently enough. The excess fat is stored in liver cells, where it accumulates and causes fatty liver disease. This buildup of fat can be caused by a variety of things. For example, drinking too much alcohol can cause alcoholic fatty liver disease. This is the first stage of alcohol-related liver disease. In people who don't drink a lot of alcohol, the cause of fatty liver disease is less clear. One or more of the following factors may play a role: obesity, high blood sugar, insulin resistance, high levels of fat, especially triglycerides, in your blood. Less common causes include pregnancy, rapid weight loss. Some types of infections, such as hepatitis C, side effects from some types of medications, such as methotrexate, Trexol, tamoxifen, Nolvadex, amiodarone, Pacerone, and valproic acid, Depakote. Exposure to certain toxins. Certain genes may also raise your risk of developing fatty liver. How is fatty liver disease diagnosed? Because there are often no symptoms, it is not easy to find fatty liver disease. Your doctor may suspect that you have it if you get abnormal results on liver tests that you had for other reasons. To make a diagnosis, your doctor will use your medical history, comprehensive physical examination or suspected body location, various tests, including blood and imaging tests, and sometimes a biopsy. As part of the medical history, Your doctor will ask about your alcohol use, to find out whether fat in your liver is a sign of alcoholic fatty liver disease or non-alcoholic fatty liver, NAFLD. He or she will also ask which medicines you take, to try to determine whether a medicine is causing your NAFLD. During the physical exam, your doctor will examine your body and check your weight and height. Your doctor will look for signs of fatty liver disease, such as an enlarged liver. Signs of cirrhosis, such as jaundice, a condition that causes your skin and whites of your eyes to turn yellow. You will likely have blood tests, including liver function tests and blood count tests. In some cases you may also have imaging tests, like those that check for fat in the liver and the stiffness of your liver. Liver stiffness can mean fibrosis, which is scarring of the liver. In some cases you may also need a liver biopsy to confirm the diagnosis, and to check how bad the liver damage is. Progression stage and complications of fatty liver disease. People with NAFLD, NASH are all believed to be at an increased risk of developing liver cancer. Fatty liver disease results in fat infiltrating the liver and it may cause no damage, but it can result in serious complications. Fatty liver can progress through 4 stages. 1. Simple fatty liver. There is a buildup of excess fat in the liver. 2. Steatohepatitis. In addition to excess fat, there is inflammation in the liver. 3. Fibrosis. Inflammation in the liver has caused scarring. 4. Cirrhosis. Scarring of the liver has become widespread. Cirrhosis is a potentially life-threatening condition that can cause liver failure and lead to liver cancer. It may be irreversible. That's why it's so important to prevent it from developing in the first place. Treatment for fatty liver. There are currently no medications to treat NAFLD. Depending on the stage of the disease, however, some people can reverse it. Gradually reducing body weight by at least 7 to 10% can improve disease activity. However, losing weight too quickly can make NAFLD worse. A healthful way to lose weight gradually is with a balanced diet and regular exercise. People who have alcoholic fatty liver disease may be able to reverse liver damage and inflammation or prevent it from getting worse by not consuming alcohol. However, this will not reverse cirrhosis. Doctor can advise on how to give up alcohol safely and supported way. Medication and surgery are both treatment options at this stage, if complications of NASH and fatty liver disease progress to cirrhosis and liver failure. If you develop liver failure, you might need a liver transplant. How to prevent and even reverse fatty liver disease. There are no medicines to treat fatty liver disease. Making lifestyle changes is essential in treating and preventing fatty liver disease. This can improve the condition and even reverse it. Lifestyle changes may include abstaining from alcohol, eating a balanced diet, choosing smaller portion sizes, doing regular exercise. Eating a balanced diet and more modest portions may help a person maintain a moderate weight. Foods that may help prevent the development of NAFLD include garlic, coffee, leeks, asparagus, and probiotics. A person should choose whole grains and eat a wide range of fruits and vegetables. A person should try to avoid foods that are high in saturated fats, refined carbohydrates, or sugar. According to researchers, simple sugars, red meat, processed food, and foods that are low in fiber may lead to the development of NAFLD. Taking regular exercise is also important. Aim for 2.5 hours of physical exercise per week. Staying active, maintaining a moderate weight, and moderate drinking can all help prevent fatty liver disease. Warning: originally, fatty liver disease was thought to be a harmless condition, but it is now known that it has the potential to progress to more serious liver conditions, such as liver cirrhosis and liver cancer. Therefore, if you experiences any symptoms of fatty liver disease, you should see your doctor as soon as possible.